let us move to the panel 3. The topic for the same is redefining strategic investments in IoT, big data, artificial intelligence to rebuild India's healthcare sector. The eminent speakers for the same panel are Mr. Rajiv Sikka, CIO of Medanta Group of Hospitals, Mr. Joy Chakraborty, COO of PD Hinduja Hospital, Mr. Suresh Nadar, Group CIO of Dr. Batra's Group, Mr. GP Dwivedi, CIO of Rajiv Gandhi Cancer Institute and Research Center, and Mr. Pradeep Mishra, Associate Vice President of Central Procurement and Supply Chain from Paras Healthcare Private Limited. Dr. Pradeep Mishra will be our session moderator for this panel. Over to you, sir.
Thank you, Ayush. So I'm very thankful for providing me this opportunity to moderate this session, and I welcome all my co-panelists on this panel discussion. So as we all are aware that artificial intelligence and technology is playing a very important role, and as according to an article by PwC, artificial intelligence and robotics are transforming healthcare. New age technologies like IoT, big data, and machine learning have entered the healthcare industry with a bang. The use of artificial intelligence can solve problems like healthcare access and 24/7 patient monitoring, while comprehensive data and IoT strategies are helping healthcare businesses to transform and interpret data for widespread commercial and medical use. All of the above technologies lie at the heart of disruptions in the field of healthcare. So how can the Indian economy divert and attract more investment to develop and leverage IoT, artificial intelligence, machine learning, and big data? This event's discussion aims to provide a solution to the question and address the latest developments in the sphere. So before going to ask the questions from my co-panelists, I would request everyone to spare few minutes and highlight and give some lights about artificial intelligence and technologies used in the healthcare. I will request Mr. Rajiv Sikka first.
Sure. I think everybody knows AI. As in general, we think that AI is a programming language, because anything to do with tech means programming language. But do we ever expect any other programming language to be responsible? Why we are thinking that AI will be a responsible platform? The reason is that, and that's a major reason for so much of noise about AI. So what happens is that most of the problems which are there in the AI is because of two reasons: it's solving the problem, but simultaneously improving itself. So it's a two-way street. It gets input from a problem, updates its algorithm simultaneously. So we are thinking that AI is going to be a very responsible platform, which is not the case. So, but there are many use cases, and we'll talk about it as we move forward. According to me, AI is going to solve the problem not for the hospital like Paras, Medanta, Rajiv Gandhi, Max, Artemis. This is going to solve the problem where you have a one GP or a one medical officer trying to do justice to 200 patients coming for different line of treatments, and he has nobody else to perform. He's standing on one single foot treating patients from 8 in the morning to 8 in the evening without having adequate resources. So AI is going to be an assistance to that kind of a practitioner to help them, what they can't do with their ability at this moment. So that's my, perception about AI. And I'll share multiple examples as we move forward. And some of these examples are part of production environment in Medanta.
Thank you, Rajiv. I would request Mr. Joy Chakraborty to speak few lines about use of technology in healthcare sphere.
Yeah. So can you repeat the question?
So no. So my question is that I would request everyone, all my co-panelists, to speak few lines about the use of the technology in the healthcare. How is it benefiting the healthcare, and what we see the future of the technology in healthcare?
So I think when you ask about the technology application, first is we have seen conventionally for last several decades the application of technology in medical part. But I understand today's session is not on that. It is going to be mostly on the non-clinical areas. So if you think about that, then it comes, one part is like patient experience where we have worked a lot. Second, it comes from your IT application, whether it is HMIS and all. Then you have current trend of artificial intelligence, virtual reality, machine learning. All these are coming again in a significant way. And finally, if I talk about then big data, which is also giving a lot of contribution in terms of getting predictability, getting some sorts of decision making much easier. So I think this will be few lines to begin with, and then we'll see later.
Thank you, Mr. Joy. I would request Mr. JP Dwivedi to speak few lines about technology.
Sure. So we see at the patient journey in the hospital, patient tries to reach the hospital, patient reaches the hospital, consults with the doctor, diagnosis happens, and then treatment starts. AI is helpful in all these areas, one by one. Reaching out to the doctor, AI is helpful. Patient can ask basic questions, and AI-driven interactive sessions are there even in the hospital's websites. Patient knows about the problem and about how to go about it. Then patient experience, as Joy said, patient reaches there, scheduling, everything managed before patient reaches the clinician's OPD. The moment patient reaches OPD, AI is enabling all the data collection that has happened through previous visits in this hospital or other hospitals by virtue of having some, wearable devices or whatever means of data collection are available. Doctor knows upfront that this is the problem set and this is what we need to do. Then there is a clinical decision support system enabled by AI. So doctor knows that for this kind of problem, these are the evidences and these are kind of sort of treatment options available to me. Then patient goes for diagnosis. Precision diagnosis is enabled by AI. So whatever is seen by pathologists through naked eyes, AI algorithms show much better. Pathology, radiology, everywhere AI enhances diagnosis. And then finally the treatment options and treatment execution. So AI is all there in all aspects, all facets of patient interaction with the hospital.
Thank you, Mr. Dwivedi. Mr. Rajiv, so what are the key pillars to ensure digital transformation is in line with the latest technologies which are taking place in the healthcare system?
Okay, so fundamentally, when you talk about any transformation or anything, tech is never, digital is never sexy. Digital is never, is attractive. What is more important is that how do you solve a particular problem? So roughly 7 years back, or more than 7 years back, when I joined Medanta, folks in the management side say that, what is your digital strategy? So I said, I don't understand strategy. I don't understand digital. I don't understand. Digital strategy becomes a super bouncer for me. So let's figure it out what a typical patient needs, what a typical doctor needs, what are the requirements of a radiologist. So you list them. So I'll give you a simple example. In any hospital now, when you walk out of the hospital, be it from the OP, IP diagnostics or an ER, you carry bundle of papers, you carry X-ray films, you carry CD. So why a patient has to carry all of them? Why can't you give them each and everything in this handheld device so that he doesn't have to be worried about to store them, or when he moves from one hospital to another hospital, he doesn't have to carry them in bundles. So this way, what we are doing is that we are bringing a doctor portability and a hospital portability. Just imagine that, the statement which is so powerful. Couple of years back, we have major issues with the service provider in the broadband or in the air services. If you are Airtel, then you are captive of Airtel. If it's Jio, you are captive of Jio. Now you can change your numbers to any service provider, and there's the freedom. So we also want to give this kind of. So digital is all about giving freedom to all possible players. let's take another example. Any larger hospitals we are all representing, this is a business of trust. And when you scale, trust get diluted because you can't have the trust getting scaled up in the you can't put people to the problem. So what you are going to do is that I say that if somebody wants to know about Medanta or as a matter of any hospital, he should know each and everything about that hospital in a very intuitive and very easy fashion without even visiting the hospital. So what we have done is that we have a 360-degree view of Medanta so that somebody knows that where he or she is going to land in case she has to go for a CT or an MRI. So if you go to Medanta website, you say that I want to see how the MRI room looks like, you see the MRI room. So digital transformation is nothing about looking attractive or giving some so-called pseudo look to your enterprise. It has to be supported by a use case. If you have a use case, I have a use case. I'll give you an example of an AI use case. We run India largest CSR program in the country. It is making sure that there is a TB-free Haryana. Now it is moved to 5 states where we have hospitals. So what we do is that we carry a van. In the van, there is a AI solution. So what the van does is that as soon as the X-ray is taken, chest X-ray is taken of the patient or the potential TB patient, it says that this guy has a potential TB or no TB. So who has a potential TB? That particular scan is reviewed by a doctor and treatment starts. So in this particular case, if you look into this, there is a huge use case. But what we are doing is that if I'm running 5 vans, I'm not sending 5 radiologists in each of the van. The software find out whether the guy has a TB or not. So there are multiple examples. One common line in all of these examples is that there has to be use case which will either solving the problem of a better clinical outcome. It is giving service excellence to the patient. It is either ensuring that there is a cost optimal, which is definitely going to get passed to the patient. And the fourth is that operations becomes easy, which means that patient doesn't have to hassle. So these are 3-4 broad levers in which any digital transformation has to take place.
Thank you, Rajivji. Thank you so much for the brief answer. Joy sir, what is the status of development of AI and machine learning for healthcare, number one? And do you think is there enough funding for research and development available?
So if you ask this question from Indian perspective, my answer is going to be different, but I'm trying to give a global as well as a local idea. So for healthcare, artificial intelligence, already we have seen even in India is getting used in a very detailed and I should say in a very encouraging scenario where we see a lot of diagnostic part of it, lot of investigation, predictions, all are happening through this artificial intelligence by using that. Many of the startups, companies who are coming out with solution where this particular technology is getting used. But if you look at in the global perspective, other than this diagnostics or maybe some sorts of predictability, the application has gone much beyond that. What all they're doing, they're using this for patient experience. They're using in a huge way in terms of clinical management apart from the diagnostics procedure. And if you ask me about the funding and availability of resources, I think India is yet to match or come up in the level of Western world. And obviously not only for this field, in everywhere the funding and research thing is in much more advanced stage. But the encouraging bit is we are probably taking it in a very fast and in a very progressive way, which will help us in India to take a major better position very soon, where you will see that these technologies are going to be helpful for the patient, helpful for the hospitals, helpful for the doctors. As a result of that, the entire healthcare ecosystem is likely to be benefited.
Thank you, sir. Mr. Dwivedi. So my question is that how can investment in artificial intelligence, machine learning, IoT, and big data make patient treatment care and delivery more dynamic?
Okay. So again, it is all technology that is available today, which, as Rajiv said, not even think of about 7 years back, 8 years back. How it is made more dynamic. Most important problem that doctors are facing is data entry. That is a problem. AI helps capturing data at source without data being entered. Vitals are captured. The preliminary tests at bedside, endpoint tests are captured. Results are stored there, analyzed. More than that, when it comes to the diagnosis, people say that the nidanam is more than 50% of the treatment, because correct diagnosis is very important. Precision diagnosis is one thing that AI has given to us. We talk about radiomics, we talk about digital pathology. For example, you take MRI of a patient, the prostate cancer patient, and it says it has come to PIRADS 3. That means it is indecisive, whether it is malignant or benign. The only way out is to do the puncture and do biopsy with 16, 17 drills. Then the poor man's prostate is gone. And then finally lab says, no, it is benign. This is the way AI helps. Patient could be saved from all this torture and the health consequences that come after the biopsy, just by right use of radiomics. So proper diagnosis, timely diagnosis, accurate diagnosis is the next step that AI helps with. And thereafter, analytics-enabled treatment protocols, clinical decision support, system supported by AI. With deep learning, system learns every time that this particular patient belongs to this group or category where this treatment has been proven to be much more efficacious than others. So yes, it is all over.
Thank you. Rajiv sir, what functions do the artificial intelligence, machine learning, big data, and IoT technologies enable in healthcare that were not possible before?
Okay, so I think Dwivedi sir mentioned about it. So let's take what are the possible areas in a typical hospital healthcare service environment. OPD, diagnostics, IP, and OT. I'll take one of these examples and I will share that, some which are in the production stage, some are in the pilot stage. I'm talking about Medanta, I'm not talking about the whole world. In OPD setting, I took an example where a chest X-ray, we can figure it out by an AI whether this chest has TB or not. So they are working on some other disease pattern also. So this TB is in production, another disease pattern is in the stage of POC, which means parallel run is going on. So this is an example of a diagnostic. I'll give you another example of OP. What we have seen is that mostly for a given symptom, a given doctor writes almost same prescription with respect to the recommended diagnosis and recommended medication. What happens is that if you ask any doctor what are his challenges, he says that Mr. Suresh Nadar, if you can put yourself on mute, it will be great. Yeah. So coming back to this, Pradeep, what I'm saying is that if you ask an OPD doctor who runs large OPDs, he says that most of the time I get calls from the patient even after the OPD or from their home. Sir, you have written this medicine. How should I take this? Sir, I'm yet have started taking your medicine, but I'm having a bowel syndrome or I'm having a lot of gas. So he says that, okay, why don't you add this? Why don't you add that? So what happens is that most of the time there are medication errors which are related to adding supplements, adding right way of having a particular medicines. So all of that, what we can do is that we can easily do a complete OPD prescription based on a given symptoms and in a very well categorized form, which means that these are your diagnosis, this is your recommended medicines. So what happens is that system will give you that it looks like this. Doctor has a choice to drop two medicines, add two more medicines, drop one test or add one more test. he's not wasting time in writing or documenting the prescription. That saves a huge time. So this is based on the machine learning algorithms of how doctor prescribes to a particular symptom. So this is an example of an OPD. We are already doing a POC which is getting executed at 3 hospitals with 5 doctors each. So hopefully we will go live in April first week. I'll give you another example of IP. Uh, Sepsis, we all know, is one of the major reasons of mortality in a typical ICU setting. Sepsis, for other listeners, is systematic failure of organs one by one. So in this particular case, if one can figure it out, when the patient is going to get sepsis, we can decrease the mortality by 14% each 1 hour we find out earlier. So it's a huge grace for ICU patient. There are algorithms which we are doing. We have a Hadoop cluster in which we capture 20,000 data points about each patient per day. And it's a huge, we are doing some work on this. And hopefully, if sepsis can be detected in advance, it will save a lot of life. So these are, a couple of examples. Robotic-based surgery are definitely, quite mature technology in any hospital, as a matter of fact now. So did I answer your question?
Yes, sir. Joy sir, would request to answer the same question. What do you think that technology is enabling in healthcare that was not possible before?
So I can tell you again, we are talking about the so-called technology related to artificial intelligence and the predictability related. Earlier, I don't think we are able to get some sorts of diagnosis done because there is shortage of clinicians, doctors in different fields. Now, if we really need to bridge the gap, we need to have support from technology which will help us in terms of doing screening at certain point of time. So that has become very easily possible. In fact, we run rural program where we may not have qualified, doctor to see all the patients. So what we do when we need to do is eye checkup, we use that, and whoever needs some attention, they are screened from there, and those cases are accumulated. And whenever the senior expert specialist the visit, they are presented to them. Similarly, when you are doing, mammography, breast for the breast, when you need to do, again, you may not have a lot of these experts available to give reports. But when this technology gets the image, they can identify whether there is any abnormalities there in that, particular image, and on the basis they can refer the case to an expert. So like that, whether it is centralized, again I'm moving on to a different type of technology. It is a centralized ICU monitoring. You think about your resource optimization. So we have one of the projects very interesting where you can look at your human resource. You can do the optimization by seeing that what kind of utilization is there for every human resource, when especially they are moving from one place to the other place. Monitoring and keeping track of them may not be very easily possible. The third example I can give you in terms of our health checkup patients, when they come, they move around multiple touch points. It is very difficult for you to keep a track and ensure that your queue management is proper. That means everybody should not follow the same pathways and go from X-ray to ECG, ECG to ultrasound. So it detects very smartly that where do you have more waiting, where do you have less waiting, and accordingly they divert and guide the person who has come for the executive health checkup to the right place. So I have given example of diagnosis, I have given example of treatment, I have given example of patient experience, resource optimization. So all these areas were not were not possible before, and that has become possible only when you have adopted these technologies.
Thank you, sir. So Mr. Suresh Nadar has also joined. Welcome, Mr. Suresh, to the panel. Can you hear me?
Yeah, thank you.
Okay.
Yeah, I'm able to hear you.
So, okay.
Yeah.
I would request to, speak few lines about what is the benefit of the technology in the healthcare and what you see is the future of the technology in healthcare sphere.
Yeah. So especially that when you are talking about, see, in our homeopathy, it's not like allopathy because the patients are with us more than 10 years. Certain patients maybe with 6 years. So without technology, I may not be able to take care of their history. I have to whenever I'm medication anything. So the I have to verify that from the beginning to end. It is a holistic solution. So without IT, without technology, without having the data, doctor may not be able to, take a decision what has to be done. So that level of, the technology is required in my, especially that, Dr. Batra's group. And before the day one itself, the Dr. Batra is technology because it is always a centralized because the patient can move one location to another location, international to here. So without technology, this is not at all possible. The case history has to be changed from one location to another. The doctor will be different. Without the history, we can't do that. From that angle, definitely the technology play a major role in our environment.
Okay. Can you give some examples how in your current in your current organization how the technologies has helped you?
See, one is we are having a technology. See, one is the storing of the data. That point of view, because we have to store the data in a systematic manner. Okay, so that series of questions, representation, everything. So that is the first one. Without technology, it will not work. Okay, manually it is not possible. Okay. Second thing is now we are having a 3 decades of data, patient data, and those who are cured, how they cured. Now we are using all the cured case, all the data, and we are using our the machine learning technology and artificial intelligence. We are now implementing to mine the data. What exactly it's like a research. I mean instead of giving X medicine, so the Y medicine is given to that patient over a period of time it is cured. So why can't we give that? Such a recommendation system we built recently. So that and all helping in a doctor community in a huge way.
Okay, thank you.
And customer experience point of view, definitely that we are having 200 clinics across that so the patient used to come to the clinic that all the data are available in the front desk. So by clickings by data whatever may be simply you will get everything, the history of the front desk know that when he joined what is today, everything, what are the what has to be done, everything is available in one click.
Okay, thank you. Mr. Dwivedi, so I would ask the same question which I asked Rajiv ji and Mr. Chakraborty, is that how technologies, how technologies are enabling healthcare that was not possible before?
Can you hear me?
Yes, sir. Yes, sir.
All right. So
Yeah.
10 years, 11 years back when I joined Rajiv Gandhi Cancer Institute, I saw nurses were maintaining 100+ registers. Now when they have to write in so many registers and fill up so many forms, what time I wonder they will be able to give to the patient. Technology has made everything so smooth for them. Doctor is writing a chemotherapy workflow. Now that work automatically chemotherapy protocol is ordered and it goes to a pharmacist. The pharmacist will do the matching between the doctor's orders, dose, and the packaging. Now it automatically goes and waits at nurse's dashboard. The moment patient is admitted, nurse need not wait for file or anything. Nurse can easily click order medicine. Just one click, and the entire order is prepared. Then nurse can just exclude some of the items which are there already, and then it automatically goes to the pharmacy. Now, after that, when pharmacy has dispensed, medicine needs to go to cytotoxic mixing area. Again, nurse used to fill up a detailed form. Now, everything is auto-populated by a program, and the cytotoxic pharmacist what he will do, he will just scan the barcode of the medicine. System will tell whether correct medicine has been dispensed or not. The moment it is certified that it is the correct medicine by just barcode scanning, mixing will happen, it goes for administration. Now again, barcode enabled medication administration record. Nurse need not maintain in registers or anything, just scan and it will record by which nurse at what time to which patient that the medicine has been given. I'm just giving you an example. When you relieve nurse of her 40 to 50% of the work, it will improve patient care, it will improve patient experience, and it will improve clinical outcome of the patient. Similarly, many, as I told you, clinician decision support system, as Mr. Chakraborty and Rajiv were telling, the treatment protocol comes, the prescription is almost prepared. Just you add one or two more medicines and it is done. Now look how happy the doctor will be. When doctor is on the ward round, just do the voice recognition enabled and automatically the notes will be captured. Unfortunately, technology is not keeping pace with our expectations, but very soon we'll be there by the lot of startup ecosystem being there, we'll reach that maturity. And probably the kind of inertia that we are looking at will be accomplished.
Thank you, sir. Thank you. So I would, this would be my last question. I would request all panelists to answer one by one. So Rajiv, sir, will data consolidation and development of clinical therapies with technology pose a challenge to Indian scientists and healthcare experts? What are your views?
So answer is again the same. See, first of all, what is in it for me is very important. Data scientists, researchers, clinicians, and IT folks have to understand that what problem we are going to solve. Is it going to be, super efficient for future? Is it going to reduce errors? Do we know the algorithm? And if somebody, see, in any problem which we are trying to solve through digital transformation, we need to know that what is my input, what is my expected output, and what transformation or what logic we have to apply in this particular case. So I think it is definitely going to solve the problem. It will have lesser and lesser dependency on the long cycles, provided we have been able to articulate, document, and make sure that this is a kind of almost 100% idiot-proof algorithm. Yes.
Okay. Thank you, Rajiv, sir. I think Joy sir has logged out. So JP sir, what are your views about this?
See, I don't really see a challenge other than one, that in a computerized environment, every good work or bad work is magnified. So if you make a mistake, the most important bit will be, if there is a truncation, then what will be truncated? It will be most important bit. So the problem will actually multiply 1,000 times. So you need to be much more careful now while using the automated processes, automated systems. Other than that, it is going to be of immense help to everyone in the healthcare ecosystem.
Thank you. Mr. Suresh Nadar, what are your views about this question?
I am aligned to the same, because the logic, whatever the things should be vetted, and if it is accepted and perfect, then we should go ahead. I mean, that's what.
Okay. Thank you so much. I would thank all the panelists for joining, and over to you, Chandan.
Pradeep, Chandan was not expecting you to finish so fast.
So if Chandan was not expecting, let's take it for a few more minutes. So Rajiv sir, I would.
Are there any questions from audience?
Yeah, there is no question. I think I could not see any questions from the audience.
So either we are so clear or we confuse them so much.
So Rajiv, you are the savior. Tell more.
Yeah, tell more about your recent examples in Medanta.
So, Pradeep, there are two very clear-cut ideas which we have to look into. How do we make patients' life simpler, and how do we make doctors do their job more efficiently so that they can see more and more patients. So in this particular case, there are two simple examples which recently we are doing with respect to patient service excellence. Highest number of complaints in Medanta, and to best of my limited knowledge, it's there in all hospital with respect to discharge of TPA patients, because it takes huge time for TPA to come back. What we are doing now is that we are doing a POC with few TPAs in which a complete bill will go to the TPA. Hopefully, within 5 or 10 minutes, rejections of acceptance and which line items got accepted, which got rejected, will come in a simple reports. If your bill is say for 1 lakh rupees, it will tell you that we are only approving 95,000 rupees, and these 5,000 got detected for these three line items. So just imagine that in 10 minutes you have this complete answer, how fast it will be. So this is one part. Second thing which we are attempting right now is that we are coming up with a POC and say infrastructure chain also on a transport management system. Yet a lot of people must have heard about it. But second problem, I'm not taking food. Food is always a problem in any hospital, even if it is best coming from the Brai or Taj in a hospital. Second problem is that when a patient has to be moved or after discharge, he has to go in a wheelchair to the launch. There are times when it takes up to 15 to 20 minutes for a wheelchair to come from the base station, or even if we have a 15th floor building, 2.1 million square feet of area, and we have 3 base stations, but still it takes 15 to 20 minutes for a transporter to come with a wheelchair, and sometimes even in the IPD when patient has to move to the diagnostic center or the radiology area, it takes 15 20 minutes. It's a huge wastage of time. What we are coming up with a Uber-like system by which each transporter will have a tag and system will ping him, the one which is nearest to the caller, and hopefully this will reach the caller in 5 minutes. Within 5 minutes, it's the hypothesis we are working on. It's already in the POC stage in Medanta.
JP sir, I'll request you to quote some examples in your current organization using technology.
So see, two most important touch points. One is after patient gets admitted and before the treatment gets started. This time is very painful for the patient. So if we can reduce that to almost zero, that is very helpful. And technology is enabled to reduce this, minimize this. And the second, as Rajiv said, the moment doctor orders the discharge and patient leaves the bed. So maybe cash paying, self-paying patient or the third party TPA or insurance paid, having a direct link with the providers and payers, that helps. Automatically these approvals flow in time. Then automation of the discharge processes internally also, because there is a lot that is required to be done. Signing of a discharge summary itself is a problem. So when technology is enabled and the discharge reaches the doctor, it reaches the billing in a seamless manner, this will save a lot of time and save a lot of agony to the patient.
Thank you. Mr. Suresh Nadar, can you give some examples wherein use of technology have helped your organization?
See, our organization is totally technology driven. Hospitals, we don't have a hospital setup. It is like just a clinic. The patient will come, the doctor will see for 10 minutes and he will prescribe. So our most of the thing is, the customer experience, the curing. I mean, that's the only point we will always look at from the technology perspective.
Okay, thank you. Rajiv sir, I had the healthcare providers, the major emphasis of all the healthcare providers have been to become cost efficient. And the success for every organization is how cost efficient they can become. So can you throw some light? How can the organizations become more cost efficient using the technologies?
There are multiple ways, and some of them are very simple and can do wonders. In any hospital, if a patient has to come and he has to stand in a queue to say pay the bill for the OPD consult or a diagnostic services. Is it possible that if I can send them an SMS link confirming their appointment with the doctor or for a diagnostic services, and along with that saying that you can pay in advance, and if you pay in advance, a receipt will come, which is like you taking your boarding pass. So I can reduce half of my billing staff. Another example: somebody walks in, I will put QR code at multiple places. You scan the QR code and you select the services you want to avail and pay. Again, I'm not using my infrastructure. Infrastructure is of the patient, which is handled. Mine is just a QR code. Okay. And payment automatically goes. Receipt comes to the mobile phone. Patient walks in. This is the simplest example. And I'll give you some other examples. Like I took the example of it, transport services, which, we are very sure that we'll be in a position to reduce the the workforce to almost 30% within a year. So that's a cost saving because instead of roaming around, there are multiple such examples, both in the OPD, IPD, where we can avail basic tech, which other industries have done long time back. So I think healthcare industry is very slow in adoption of tech, but we will do, saving by adopting some of these tech.
Thank you, Rajiv sir. So there is a question from audience. I would request Mr. Dwivedi to answer. How can we take the technologies to the rural parts of the country and ease out the diagnostic and treatment scenario?
Wonderful question. This is where even Government of India is working so hard. And this is one thing that now has become possible, which was not possible a few years back. What is required is telemedicine, very strong backbone of the communication, and more spreading awareness in the patients so that they can contact the doctors from home. Vitals could be captured, reports could be uploaded, doctors can see, and then treatment can happen at home itself. I want to add to the question that you asked to Rajiv. See, when patient comes through the emergency route, it will cost at least 3 times more than coming through OPD route.
Yeah.
If there are technologies available to monitor the health parameters and keep the health under check so that avoid the situation of coming to the emergency, then that will be the biggest contribution to the even healthcare providers, which are reeling under the pressure, and to the patients to save a lot of money to them.
Thank you. And so this is about the cost of the healthcare. And if I ask about how can the organization reduce its cost, what would be your answer using technology?
See, number one is you see reams of papers. How many papers were written? How many registers are prepared? How many staff members are required to maintain all that unnecessary redundant documentation? Very rudimentary example. Then measuring turnaround time at every stage makes even hospital staff aware that their performance is being monitored. And automatically you see the turnaround time will improve. Every single hour of loss, average length of stay reduced by improved processes and process excellence will ultimately result into savings for the patients and for the organization both.
Right. So Rajiv sir, I believe Medanta is doing a lot of technology integration and they are coming up with community clinics and all. So I would request to answer the question from audience. How can we take the technology to the rural parts of the country and ease out the diagnostic and treatment scenario?
So I think Dwivedi sir has already answered. One part is that telemedicine has seen the success in the last 2 years. Complete country was struggling with telemedicine adoption, and it was at lowest minimal level. But in last 2 years, I think doctors and patient both, and that too in the rural area. 40% of the patient in the peak of pandemic were coming from the non-metro cities in Medanta. So this is one example. Second example which I took is we don't have radiologists in each and every part of the country. Just take simple example of chest X-ray. Chest X-ray is the first line of diagnostic because what chest X-ray is a low cost, is no invasion, and very easy to do. Within 1 or 2 minutes, your chest X-ray is ready or any X-ray is ready. But reading it takes a lot of time, and we have shortage of radiologists. So in this particular, you have a chest X-ray technician, you have an X-ray technician, you have an X-ray machine, and then what you have is an algorithm software by which report will come, which is almost like 80 to 90% right. So this is one other example. Examples of teleradiology, telehealth, remote ICU, which Mr. Joy talked about, are some of these examples. You don't have to put high-end critical care doctors. We all know that critical care doctors are kind of the rarest species, not just in India, but worldwide. So can I put ICU machines in the smaller clinics in town B, town C cities? And can they, on the back of a good fiber connectivity, reach to a larger hospital where critical care doctors can see, guide the doctors there? So these are multiple examples which are there in any environment.
Right, sir. JP sir, there is one more question from audience. I would request you to answer. The question is that can public-private partnership ease the reach in rural, urban of emerging new age technologies?
Absolutely. So you see, we need to have a very strong referral system. That is almost missing in our country. So a lot of patients in urban areas, they will just straight away go to tertiary care hospitals like Medanta. And in rural areas, that link is missing. So from the PHC to the tertiary care, proper referral system should be there. And of course, by ensuring public-private partnership, the PHCs can refer the patients to the secondary care or tertiary care hospitals, all being connected through technology, patient health record being shared interchangeably. These are some of the actually projects that Government of India is already eyeing on. And once that sees day of the light, you will see the results coming all over. So the people in very remote villages will be able to get top class services based on the need, not based on your resources. If you need it, you will get it.
Thank you so much, JP sir. I think Joy and Mr. Nadar has logged out. So I would request Rajiv and Mr. Dwivedi to close the remarks with their closing remarks.
Sir.
Yeah, Rajiv.
Okay. So, Pradeep, let me state, there are a couple of observations in the healthcare space which are definitely going to, we will all see in near future. I'm not talking of 5 years from now, I'm talking of very near future. First of all, larger hospitals also have realized that care can be given outside the hospital also. So which means that we are moving away from the physical infrastructure and by not compromising on the care part. This is the first part. And we have seen it in COVID, how government also and regulatory bodies also, including hospitals, decided to treat patients which are asymptomatic or less symptomatic in their home or in the isolation centers. Second thing which is bound to come is, whenever we say remote, this is a remote care. It means digital. And COVID, when isolation means remote means digital. So COVID is going to be transformation the digital. So digital is going to play an important role with the help of mobility. I'm not saying mobile solution, I'm talking about mobility. Mobility is going to play an important role. So next time, whenever we talk digital in any form, we should start thinking, is it mobile? Is it, can I apply mobility rules into this? Third thing, which I am of the opinion that COVID didn't give you time. He says that do it now. So answer or the trends which I'm going to foresee in near future, even in the healthcare, is that, done is better than the perfect. Don't look for perfection because perfection will not come immediately. I'm not saying that you do a compromise on the critical care part, you do a compromise on the quality of the care, but don't try to wait till infinity for perfection to happen. Then you will lose the confidence of the patient and the public in large about the delivery and the speed of the healthcare.
Thank you, Rajiv ji. Dwivedi sir, your final remarks.
So finally, there are a lot of things being talked and discussed in seminars like this. The need of the hour is to bring them to the reality. Most important is infrastructure. We have robust infrastructure in place, and then implement it in a way any transformation happens, using people, process, technologies under a proper framework of policies and governance. So once all these pillars are in place, we will eventually reach the place that we are eyeing for.
Thank you so much. I would thank all the my panelists to participate in the panel and provided us the opportunity to get a knowledgeable information from their rich experience. Thank you, Rajiv sir. Thank you, Dwivedi sir. Thank you, Joy Chakraborty sir. Thank you, Mr. Nadar. Over to you, Chandan.
Yes, thanks, Pradeep. In fact, a very interesting session and a vibrant, talk been coming from the stalwarts of the industry. In fact, Rajiv sir, I remember in the month of October when we had an opportunity to, engage you as a panelist in the Digital Health Forum. You were very excited in telling that the way your expansion is happening, and I guess Patna was the next, Medanta is going over there. How do you find these technologies as in different cities when you compare with Gurgaon and the city like Patna? The use of this technology, is it easy? I understand training is one of the part which has to be taken place and for the staff who are trying to use this thing. It's not only the technology, but how easily are you using those technology, and are patient responding to such kind of use of technology, or they are too still inclines towards the traditional mode of operating them?
So, very, very appropriate stuff. And trust me, I'm going to speak on this. And my own observation and reading of the situation surprised me a lot. Okay, so there are two aspects. One is the patient part, and another is the internal hospital staff, which is the caregiver team, radiologists, physicians, nurses, and so on and so forth. So, since Patna, you took an example of Patna. Patna is a relatively young hospital. It's just 5 months old, 4 months old into the ecosystem, and relatively the rush was less compared to Gurgaon. So, a lot of doctors and clinicians said that, why don't you train us on this? Why don't you train on this? So, there was a full-fledged training done, and I think, this is not a very high-fi training. It's not like a 5-year course of the medicine side. So, adoption becomes very fast because there was a hands-on kind of a training. And all the tools which took years and years for us to implement within Medanta Gurgaon, all of them are 100% active in production in Patna in 4 months. Okay, and some of them are typical AI. I'll give you an example. Which Pradeep mentioned, asked about how you institute cost. It is not about purely cost saving. In healthcare, you don't think cost is an important pillar to support. All of us, go for a film printout of an X-ray or a CT or an MRI. It's a huge issue with respect to carbon footprint of any organization. Because if people don't turn up to collect them, there is a small hill of that lying in Medanta, hill of films. To dispose them is a challenge because it has a silver. You have to take pollution control, permits and licenses and other stuff. It's a huge cost also. If paper costs you, say, 1 unit, this costs you roughly 7 or 8 units. So 1 rupees versus 8 rupees. And we do roughly 1,000 plus per day. So just imagine the cost. So what we have done is that we told doctors that this is the way you get, implemented. So within 1 week, we moved away from the print. 100%. Okay. So adoption. So as far as the patient doctor part is concerned, I think adoption is like filling. We are super amazing. As a matter of fact, 2 new POCs are not getting done only in Patna. They are not getting started from Gurgaon. I know that, if I'm getting a good response, it's like a testing the market. So I'm testing the market in Patna now. With respect to patient, yes, there is a bit of challenge. We need to tell them that, sir, you have an ability to pay through Paytm. This is, take cash. But when you talk about doing telemedicine in Patna, we get same response mainly for follow-up patients. If you have to show after 3 days, after certain lab tests. So we request them, you can come in person also, and you can come through telemedicine route also. And we have seen our telemedicine consults have started picking up in Patna like anything. And and when we did deep analysis, we realized that most of these are follow-up calls. So which means both doctors and patients have realized that not to go for unnecessary visit in the hospital is the source of infection, unnecessary commute, and unnecessary wastage of both the times. So did I answer your question, Sandhu?
Absolutely, sir. Thank you so much for it. In fact, my second question attached to it would be, if time allows, because we do have some time, and if you're not occupied anywhere, I would like to have something more because the discussion is going interesting. I admire, sir, and people, they also acknowledge you as being a leader, especially when IT function comes. And you have done a lot into the IT function, covering the digital transformation initiatives. And I also remember you said something about your 5 years IT plan. So normal operation and administration plan, in fact, it is planned maybe quarterly, yearly. How the idea came in your mind of 5 years IT plan, sir? That vision is definitely, if you can just throw a light on us.
No, so I said it early in the discussion. See, somebody asked to make a digital strategy for any forward hospital. It is too difficult. First of all, my definition of digital versus your definition of digital versus a digital definition for a nurse is totally tangential. And then strategy is like quite bouncer, it's like abstract for me. So I said that let's understand that what are the typical problems for all the stakeholders in the ecosystem. One is definitely the patient, which is the center. Then for you, rest of the world is doctors. For us, there are different grades within the doctor. Surgeon is different, radiologist is different, lab doctor is different, physician is different, and so forth. Okay, so we have to come up what are the challenges. So we did, the thorough study. And doctor in the OPD is different, same doctor in the IPD is different, and same doctor in the ICU is different. So because ecosystem changes, and so we have to figure it out what are the problems. So what we did is that we list down each and every problem, and definitely patient problems were the foremost. And for each of the problem, we said that what we are trying to achieve, we have to improve patient outcomes. Patient outcomes means their clinical outcomes becomes better. Second thing is that they don't get harassed in any larger hospital, so which means service excellence. Third part was that how do you ensure revenue assurance? Revenue assurance is different from revenue enhancements. Revenue assurance means that there is no leakage of the revenue, which means that if somebody is getting a test, at least it gets billed. So this is assurance. Fourth is that how do you ensure that there is a cost optimization, which Pradeep spoke about. And fifth part is that operational efficiency, which means that for a given cost, you do the job in better way. So these are the 5 digital pillars, and we have various stakeholders, their problem, and a simple matrix was made and said that let's define the priority, and we started with the priority. Each was a use case. Moving away from the paper, from the films to a paper print is one use case. Moving away from giving the paper printout of the reports and having them on the handheld device is another use case. And there was a list which got implemented, because once you know what is the desired output, I think journey becomes easier.
Lovely. Great, sir. In fact, yeah, that reminded me. Definitely, you said this, but now I was able to recall the factors which made you, make a plan of IT. In fact, the kind of discussion which you're having in this forum would definitely lay a foundation stone. If how can they plan at least not 5 years, then at least a yearly plan of their IT services in at least small and bits pieces can definitely be done. That will help to enhance their activities. Dwivedi sir, my question to you: the time you started the patient journey. For the time he inquires about or he diagnoses that this is a problem, then he searches any hospital, he lands, the kind of service he gets. Forget about the AI and ML, sir. जो पहला कॉल वो हॉस्पिटल में करता है, ये जब पहला फुटस्टेप वो सीढ़ियों पे चढ़ता है, the way he is treated, इसके ऊपर would you like to throw some light? Is that patient feels special कि now you are into a right hand and care, which is definitely not a responsibility of a doctor or a surgeon. It's a responsibility of that desk where he comes and first inquires, or the call bell who is being taken care by any of the junior executives. Any advice for them, sir?
Absolutely. See, I think empathy, and particularly in oncology setup, is very important. The way you receive a patient, the way you answer the call, the way you guide, And your face, there is a physical face, there is a virtual face. Hospital's website is our virtual face. Now we should orient the website in such a way that patients gets all the knowledge that patient needs. Any symptom, any problem, this is the way you should proceed. And then when patient comes, patient sees that warmth, and processes enable patient to avoid unnecessary harassment, if you like, and reach doctor in a very predictable manner. That helps a lot. And then, of course, doctor does the treatment and the pathologists do their diagnosis. But the non-clinical processes are equally important. And technology plays a huge role there also.
Great. Thank you, sir. Yeah, this was the input I wanted to understand about. Pradeep, would you like to highlight on the same part of it, because you are representing the procurement division. So what are the minds in your brains when you go for such kind of procurement, or when you select a staff who should join your organization? Pradeep, my question to you.
Yeah, say again. What is your question? I was actually,
Pradeep, I was asking. Now you are into a central procurement, division, and the supply chain management. Definitely, workforce management is one of the very crucial factor which comes into your KRA. What are the factors in your mind when it comes for training them or motivating these people, those who are a part of a central procurement or of a supply chain division?
Okay. So if I talk about the use of the technology in supply chain, that is immense. But your particular question is that how we use the technology to keep the workforce motivated.
Yes,
so basically, what we do that we have clear-cut KRAs of all our employees in place, and then by use of the technologies, we can measure the outputs of their KRAs. We can measure their KRAs, we can manage the quality, the kind of work, what is the quality of the work, what is the quantity of the work they are performing, and the basis of that we we reward them, we make them comfortable, and if the person who is not able to meet their KRA, we encourage them to achieve their KRA. So yeah, technology is helping us to in both ways. Number one, in our workforce management, as well as our day-to-day supply chain functions.
Okay.
Yeah.
Great. Thanks for your input, Pradeep. Yeah.
Thank you.
So with this, now we are through with this panel session. I think very nice and some very interesting facts and figures came out from the case studies, and definitely the topic which we have decided. All these topics have been well researched, and then we try to frame it with a background and the questions laid to it. It is the same effort when it goes in selecting the panel as well. So thank you so much, all the panelists over here. Mr. Rajiv Sikka ji, the CIO of Medanta, Mr. Joy Chakraborty sir, the CEO of PD Hinduja Hospital, Mr. Suresh Nadar, the Group CIO of Dr. Batra Group, JP Dwivedi ji, the CIO of Rajiv Gandhi Cancer Institute of and Research from Delhi, and Mr. Pradeep Mishra, who was moderating the session there, Associate VP, the Central Procurement and Supply Chain from Paras Healthcare. May we please have the honors of felicitating all our speakers for this panel. You can play this, Shubha.
Thank you.
Yes. Thank you, sir. This is a small token of appreciation to you.
Thank you.
The second certificate we are presenting it to Mr. Pradeep Mishra.
Thank you, Chandanji.
Thanks, Pradeep ji, for joining us.